Okay, good morning everyone. My name is Dr. Sharma. Today I'm going to teach all of you how to, in a very rudimentary sense, design a hairline at home using some very basic principles. Please remember, when I actually design these hairlines in the surgical room or with my patients, there's a lot more nuance and complexity around this, but this is a simple and very basic idea where a lot of you can sit at home, play around with your hairlines, and I think it's quite fun. Like, don't we all like doing this on a Sunday evening? Anyway, so when you first look at the face, we need to think about the power of 3. Once again, this doesn't apply to everybody. I don't follow this religiously, but a lot of you ask about this. So the face, typically, we want to partition it into 3, 3, 3. So the first measurement is between the nose and the chin, and the next measurement is between the nose and between the eyebrows. And then finally, we look at the distance between your eyebrows here to this. So typically, this measurement between the tip of the nose to your chin should be the same as from the hairline down between your eyebrows. So that's sort of the first line that we want to draw. And once again, depending on how old the patient is, this might be lower, higher. Also depends like where the muscle is. We don't want to be, planning a hairline into the muscle. It looks like a flying magic carpet. So that's your first line. The second line is we want to get the frontotemporal angle, or the FT point. And that's a very complex way of basically saying, as you can see, my hair in the front of the scalp, it's coming out at an angle. So it's almost sticking up. And then the hair on the side, as you can see, it changes direction. And this is where it's sitting quite flat. And that point is really the frontotemporal point. And for me, it's about here. There we are. So that's where it is right now. Now, a lot of you, the reason that you're coming in is because this point has gone backwards. And so what you see on the side, when you look at your side, is you see a lot of forehead. It's all the way up to here. And a lot of patients can't really put it into words, but this is what you're basically trying to say. And so that's the next point that you really want to address. And there's some other points that I really like to look at. I like to look at where the temporal fringe should be on men. Let's just stick to men for now. We can go on to females in another video. We want to look at where the temporal fringe point should be. And typically what I use is I like to draw an imaginary line from the tip of the nose through the middle of the pupil and out. So for myself, it'd be something like this. As you can see, if I join the tip of the nose through my eye, all the way up here, I'm sort of getting that temporal point here. So I'm okay. It should be where it is. It could do with a few more hair there, but I'm an old boy now. So we look at this line here, we look at this line here, and the next thing you want to decide is how steep should this line be? Is it going to come out very abruptly? For example, on an older Caucasian gentleman. If you're Middle Eastern, this line can sort of curve slightly less. If you're African, obviously this line can then be even flatter. It really depends on ethnicity, sex, age, many things, and also your future hairline, how it's going to progress. Now, a rule that I often like to find, which I like to draw, is if you look at the middle of the eye, the pupil, the colored part with the black dot, and draw a little line there, okay, which is here, the pen draws, and you follow it all the way up. This line here is where I typically want to have the angle less acute here. And then from this point here, mid-pupillary line up to the FT point, is where you can actually make the hairline a little bit steeper. So this line here can go further back. This line needs to be more flat if you want to create a more youthful hairline. You don't want this angle to be too steep, and this angle can be a little bit steeper. If you're older, this can be even further back. And then really, it's about connecting the frontotemporal angle with the line that we drew, which is the temporal fringe point. And so typically with the masculine hairline, it looks like an M, okay? So as you can see, it's a big M. There's the bottom of the M, there's the top of the M, and so it's like a big M. typically, lots of variations in this on age, etc., etc. The frontotemporal point is a really, really important point for me to get correct, because if I was to bring down my frontotemporal point down to here, let's just say I'm going in for a hair transplant and I'm like, no, no, doctor, I want to have my hairline like this. I want it to be like this. I want it to look like this. That's how it was when I was 18. So great, I brought my frontotemporal point down to here. There's a couple of rules you should always remember. This point generally should never be lower than the frontal point. And then that's going to feminize you. Women is often where we see that this can be at the same level, or maybe slightly above it, but that's going to feminize your hairline. Once again, different ethnicities, they can get away with it. So that's one of the reasons why sometimes when I see patients, they're coming in and they want me to drastically bring this point down, I'm like, no, we cannot do that. It's going to look silly. And worst case scenario, I just won't do the surgery. So these are the three main points that I think you should play around with. There's lots of other things we can look at which, you know, are going to really complicate things. And the final thing to say is, if I was to design the hairline here, we never want to design the hairline. This is too straight for me as well. So also we want to have zigzags, because the hairline is never straight. And so here, for example, you can see I have very fine hair. These are singles, they go in and out. And obviously behind here, it's the thicker hair. So that's typically how we design the hairline. One other thing I always ask my patients, if you've had surgery with me, I always ask you, do you want a V or do you want a straight rounded edge there? That's a typical thing, like this little point here comes down to a V. Some men like it, they find it to be quite masculine, this little V. It's these small things that really help. So yeah, so I hope that really helps in terms of how to design hairlines, and I'm going to go and clean this off now.